Good morning, Ashwin, and great to have you here. Looks like you've flown in all the way from Delhi. Nice Bangalore morning for a discussion on healthcare. So let me start first by introducing you. So this is Ashwin Naik, Ashoka Fellow, CEO of Vaysalya Healthcare, good friend, and hopefully co-collaborator in the future. And I'm Dr. Vikram from Healthcare India. And Ashwin, I want to take you back about 3 years ago when we first met. I think it was one of these digital health conclaves when you had kind of created a furor by talking about the hospital of the future, where you said that hospitals would only focus on two things, which was, I believe, one was emergency and the other was ICUs, intensive care units. So 3 years now, how do you think that is going on? What is that idea, and have you progressed on that idea? And can you tell us a little bit more about it?
Yeah, I think the genesis of this thought is really by looking back at how hospital came into existence. And one of the things that always fascinated me was how did we shift from the concept of a family doctor, a trusted provider of healthcare, to this siloed approach of a large institution providing faceless care to millions of people. So I started to look back at how this evolved, and what was fascinating was, for many centuries, an individual doctor coming to your home was the norm, till two things happened. The first was the realization, I should say the first was actually anesthesia. The minute anesthesia was invented or discovered, it was the first time two or more doctors were forced to work together, right? Because now you had to have a specialist in anesthesia and a surgeon, and the fact that you could open up a person and do certain things which were not possible before forced people to work together. So this made the possibility of a institution that could host a few people. Now once anesthesia happened and complicated surgery started to be done, that was also a great way for future doctors to be trained. Because if you think about it, before anesthesia, before surgeries, like complicated surgeries were being done, most doctors were trained on theoretical knowledge or on cadavers. Right? So now you had an opportunity to look inside the human body. So that meant that the medical colleges or the medical training came to large hospitals where lots of surgeries were being done. So this was a vicious cycle. You in anesthesia, then complicated surgeries, training, people coming to this place. The second second development which triggered this is the idea of antisepsis, the idea of infection caused by microorganisms. The minute people realize that there are some things which are in our environment which are creating infection, which leads to illness, the first reaction was, okay, let's move everything to a place which we have control on.
Correct.
Now, two things have happened in the last 15-20 years. One, most complicated surgeries, which used to take a multi-team approach, have become simpler, technology enabled, and in many cases have moved away from being surgical procedures. Right? Just look at the example of cardiology versus cardiac surgery.
Correct.
Right? The second is, in general, our hygiene and sort of surroundings have improved drastically compared to 17th century. So our infection from a hospital is actually more higher today than being at home in a reasonable setting. So these two things sort of go to the fundamental assumptions that I made of how hospitals evolved. Now, if these two arguments don't hold true, how would the hospital of the future look like? Right? And we are at the great time of this universe where technology is developing so rapidly, right? And new technologies